Colon cancer is the third most common cancer type among men and the fourth among women, with a notably high mortality rate. Studies indicate that there are at least 23.4 cases per 100,000 people worldwide. In most instances, there are no symptoms until the disease has spread throughout the body. However, certain warning signs may suggest the necessity of consulting a doctor for additional examinations. In this video, we're going to show you the top 10 early warning signs of colon cancer or intestinal cancer, as it's commonly known. Watch until the end, because one of them might surprise you. Don't forget to subscribe to the channel and like this video to help it reach more people who may need this information. Shall we begin? Sign 10. Anemia. This is a condition characterized by a lack of healthy red blood cells, or hemoglobin, which are responsible for transporting oxygen to the body's tissues. This symptom is common in colon cancer, as intestinal bleeding can occur without any signs in the rectum or stool. If you're experiencing fatigue, shortness of breath, or dizziness, it could be due to anemia caused by colon cancer. In this case, it's important to consult a doctor for additional tests, especially if accompanied by other symptoms from the list. Sign 9. Changes in bowel habits. If you're experiencing persistent changes in bowel movements, it could be an early warning sign of colon cancer. Some examples include constipation, diarrhea, changes in frequency, incomplete evacuation, and thinning of stools. These abnormal bowel changes can be caused by a variety of factors such as dietary changes, inflammatory foods, and bacterial or viral infections. However, if they persist for more than a few days, it's best to consult a doctor to determine the cause. Sign 8. Nausea and vomiting. Nausea and vomiting symptoms are also indicative of colon cancer. Cancer cells can release substances that affect digestion and food absorption. Additionally, a tumor in the rectum can obstruct the intestines, leading to the buildup of waste and toxins in the body. This can cause symptoms of discomfort as the body tries to rid itself of these substances. If you're experiencing persistent nausea and vomiting along with other signs and symptoms, it's important to consult a doctor to rule out the possibility of colon cancer. Loss of appetite. Cancer cells can release substances that alter how the body processes food, leading to a loss of appetite. It's a common symptom in cancer patients, including those with colon cancer. Researchers have found that this symptom is associated with metabolic changes and reduced food intake and can occur during both early and late stages of the disease. The sooner the symptom is noticed, the better. Loss of appetite can lead to malnutrition, which can negatively affect overall health. Loss of appetite leads us to sign 6 on our list, which is unexplained weight loss. Unintentional weight loss is a warning sign for various types of cancer, including colon cancer. It can occur due to persistent diarrhea or difficulty digesting and absorbing nutrients. Additionally, if a patient with colon cancer is experiencing loss of appetite, it's natural for them to have unexplained weight loss, as these two symptoms are often related. Sign 5. Blood in stool. This is one of the most common early warning signs of colon cancer. If you notice bright red blood in your stool, it indicates bleeding in the lower intestinal tract or rectum. You may also notice darker stools, which could be a sign of bleeding higher up in the gastrointestinal tract. Although blood in the stool can be caused by other conditions like hemorrhoids or anal fissures, it's important to consult a doctor to rule out serious causes. Sign 4. Diarrhea. Diarrhea is defined as stools occurring more than 3 times a day and is a common symptom of conditions like food poisoning or a stomach virus, but it can also be an early sign of colon cancer. While diarrhea is not an immediate concern, it's important to consult a doctor if it lasts more than a few days or is accompanied by other symptoms from our list. Sign 3 of colon cancer warning signs. Pelvic pain. Actually, pelvic pain is not an early warning sign of colon cancer, but pain. Pain in the pelvic region may indicate that cancer cells have spread from the intestines to the pelvic area. This is a serious condition that requires immediate medical attention. Therefore, being aware of this symptom is especially important. If you've had intestinal issues in the past, especially. Now, the last 2 signs from our list: colon cancer warning sign. Number 2, abdominal pain. This is a common symptom of many conditions, but it can also be an early sign of colon cancer. When cancerous tumors grow in the colon, they can obstruct the intestines and cause a buildup of gas and waste, leading to abdominal pains, bloating, cramps, and swelling. In some cases, the pain may be severe enough to warrant a visit to the emergency room. The last warning sign of colon cancer on our list is chronic fatigue. This is a prominent sign of various types of cancer, including colon cancer. In fact, researchers have found that fatigue occurs in about 80% of colorectal cancer patients, and 30% experience chronic fatigue, especially those undergoing chemotherapy. Furthermore, colon cancer often results in malnutrition and weight loss, both of which can contribute to fatigue. If you're experiencing unusual fatigue, it's important to consult a doctor to help determine the cause and understand the signs and symptoms of colon cancer. This is essential because an early diagnosis can lead to more successful treatment options. To quickly recap, the early warning signs you should be aware of include blood in stool, changes in bowel habits, anemia, loss of appetite, unexplained weight loss, nausea and vomiting, diarrhea, abdominal pain, chronic fatigue, and pelvic pain. If you experience any of these symptoms, schedule an appointment with your doctor for a checkup. The sooner you identify any changes in your body, the better your chances of recovery. If you'd like to support our channel, please leave a like and share this video with your friends. Don't forget to subscribe to not miss any new videos. Now, there should be some other helpful videos appearing on your screen, and I'm sure you'll like them. Just click on one to continue with us. Remember, we're not doctors, and this video is purely informative to help with prevention. Thank you so much for watching this far. See you in the next video.